I think we're running low on battery power of the microphone, but we'll do our best. So I think this is an interesting line of discussion, and I was interested in Namrata's presentation about the different kinds of vaccinations. So I tend to hang out in the 17th century, so a lot of this is new information to me. I associate vaccination and immunization with mass vaccination and immunization, but you were talking about this issue of surveillance immunization, where I understand that if you have 1 or 2 outbreaks, you vaccinate around problem cases. So I wondered about Byron's perspective on this. How effective a strategy is surveillance vaccination for stopping outbreaks?
Well, there's a lot of discussion about Ebola outbreaks and approaching Ebola outbreaks because they're starting to develop some of the vaccines for Ebola and attempt to vaccinate people in those villages surrounding the villages where the outbreak is, including people in those villages that have not developed disease yet. And that does work for a local area, but it doesn't prevent the outbreak from occurring the first time. But it is effective in sometimes in emergencies like an Ebola outbreak, for example.
Yeah, I mean, it's a little politically sensitive to say this. The surveillance and containment was actually practiced in low-income countries. If you look at articles by Bob Reinhardt, for example, he admits very candidly that this was a strategy, mass vaccination of smallpox for the developed world. But, in low-income countries where even access to mobile populations was, in terms of escalated costs, it was probably more effective to do ring vaccination. So there's a little bit of, it would be very difficult for us to say what works and what doesn't work. Certainly in the case of smallpox, surveillance and containment should, if our lightning rod of measuring is success and stopping of eradication, then yes, the surveillance and containment strategy works. But whether it is an effective strategy in a sort of medical and scientific perspective, we don't know.
No.
Yeah.
I will mention that you don't really know because supposing the Ebola outbreak stops on its own because people are no longer burying people, having contact with the dead, or having less exposure to body fluids. If that happens, sometimes the Ebola outbreak may have stopped without having the vaccine program. So we don't know how effective it is. We really don't.
Okay, I'm abandoning the microphone because the battery is now dead, so we will just attempt to project really well. So do we have further questions from the audience? Yes, go up here.
So in the study conducted in Nazarbayev University here, when concluding the results, you kind of combine the neutral and negative attitudes. So why is that?
I actually combined the neutral to those that opposed vaccines in part because they're easily persuaded by the internet. If you're neutral and you start reading about the risk to your child, and there's a lot of Russian sites now, the risk of your child, you're going to be convinced that you don't want your child vaccinated. If you're very convinced that the vaccine is going to help your child, you won't search out that information, or if you see the information, you probably won't believe it because your primary caregiver told you that this is safe and it's going to protect your child.
Raymond, yes?
Yeah. Namrata, could you, or do you have a sense of how the way that the official discourse around eradicating smallpox that cuts out local knowledge and cuts out all of the groundwork laid by Indians in sort of building the success of eradication, how that works to continue to limit large-scale public health engagements with local knowledge? Do you think there's a link there in that official discourse?
Smallpox is one of the biggest success stories, and then polio. In 2014, India declared itself polio-free, though it's still an ongoing program and surveillance is ongoing. But so that's one important and then link it up with local knowledges. For example, even Ramchandra Rao, he's been largely forgotten. I mean, when I started doing my work, I started looking up on him, and I realized there was hardly anything written on him. Though if you look at the Blue Book, his articles have been mentioned several times. So he was publishing quite a lot. But that doesn't feed into any kind of subsequent readings. And in fact, this book that he wrote, Smallpox, he's saying that, what the foreword says that it's intended to be a textbook. And he's saying, no, I'm actually writing smallpox as I saw it. So you see, I mean, how do we sort of construct local knowledges, and then how does it feed into our canon is quite different.
We had a question from the gentleman at the back here.
I think he was trying to say something before I will.
Oh, okay, thank you.
Yeah, thank you for these two very, very engaging talks. I want to pick up on something in Namrata's paper about basically the success or failure of these programs being played out on the ground. But I'd like to invite both of you to respond if you have thoughts. Because what I wanted to ask is basically today, we have these huge institutions like the Bill and Melinda Gates Foundation trying to run these global programs focused on eradicating some particular disease or other, billions of dollars. And when we have that kind of centralized program, what's needed to make sure that those programs are successful on the ground in the places where the vaccinations are taking place? And maybe if different approaches are needed in different contexts.
The Bill Gates Foundation is primarily right now heavily imbued in research. There are three major centers that the Gates Foundation supports by billions of dollars to find a better tuberculosis vaccine. Because BCG, though it's somewhat effective, is not as effective as they'd like it to be for the control of tuberculosis. They're also working on vaccines for malaria and also on what am I missing? TB, malaria, and the other, what's the other one? HIV, thank you. Jeez. Sorry. It's been a long week, guys, and I just had surgery too, so I'm a little bit discombobulated a little bit. But they're providing funds for many, many different research teams all over the world to try to develop these vaccines. They're not developing the vaccines themselves, but providing the funds for them. The next step, of course, once you find effective vaccines, is how do we make sure that translates into those regions and those countries where we need it the most? Maybe you want to respond to that, but that's one of the great challenges. We're not really there yet, but hopefully we will be.
Yeah. Thank you. We don't know.
Hopefully you'll be involved with the solution. I don't know.